right. Thank you everyone for joining us again in this series on pathways to data services. So we've talked about how to start data services, expand data services. We had a session on conducting data interviews. And today we have Michelle Yee, a research data and metadata management librarian at NYU Health Sciences Library. So I will go ahead and hand it over to Michelle today for finding data.
Great, thank you so much for that introduction, Justin. I will share my screen. All right, I hope the slides are showing for everyone. I do have a two-screen setup, so I may occasionally look over to the other screen. This is a class I've taught versions of this kind of workshop to researchers and interns at the National Center for Data Services. And admittedly, this is my first time adapting this for librarians. So that feedback survey that Justin had mentioned, if you have any thoughts after this workshop, we'd love to hear it. So this session's learning objectives, I hope after this workshop, you will become more familiar with strategies for locating and evaluating data sources. I'll take some time going over various resources for starting a data search, as well as sharing some obstacles to be aware of as you're working with your patron or user on a research question. You will be practicing some data reference skills in a guided activity. And the last section of the session will be talking about various opportunities for growing data services through collaborations with other academic departments. And as for how this ties in to the overall goals of this short course series, you will be learning to identify and explain different pathways to provide data services, and this is about data finding or data reference, as well as exploring how these low-cost, high-impact services can provide a foundation for building data services. So to further clarify the scope of this workshop, again, data finding, this is a specific type of reference service. It is about locating or identifying data sources to support a user need. And this term is not to be confused with the processes that enable other people to find your or your users or institution's data. That there will be the next workshop in this series, the NIH Data Management and Sharing Policy, will likely touch upon those concepts, but there is also an older webinar through the NCDS that has covered data discovery and sharing infrastructure and building that in libraries to enable data discovery. And while in the last slide I had described this service as about locating data, it really is a little bit more than that. Data finding also includes providing guidance on data access, and that can entail facilitating connections with other researchers, departments, or offices. Sometimes to access data sets, you may, or the researcher may be required, for example, to download this data through certain means, and IT may be involved, for example. They may need to sign a data use agreement, and perhaps legal offices may want to review documentation like that. Providing guidance and data access can sometimes lead to acquiring or licensing data sets as library resources. Providing guidance on data use is another area which we'll talk about briefly, and that can include creating guides or workshops on various data literacy topics, so understanding how to interpret data, or creating guides or workshops for using or about using specific data sets. For today, though, we're not going to be covering, licensing or acquisition of data sets into e-collections. This is something that is pretty complex, often coordinated with collections or resource management teams. It can be costly, and it really is worth a whole dedicated session on its own. If you would like any recommendations for webinars or sessions that do cover this topic, feel free to reach out to me. But that is not covered in this workshop today. So with those components of data reference services in mind, I'll be discussing some strategies for finding data. First, are there any questions? Let me see. Okay. All right, there's a lot of information on this slide, but to ease this in, I just want to start with a quick overview of how we can evaluate whether data is appropriate for a particular research question and what potential sources are available for data, particularly in clinical research. Data may come from responses to surveys or polls, from medical records, whether electronic or paper, administrative data. This includes claims or vital records, just information that is used for operations, not necessarily collected for a research purpose. Public health surveillance programs are another source of health data. Registries and clinical trials can collect specialized data about specific diseases or populations. Peer-reviewed studies are a vast trove of data, as well as what is termed gray literature, so white papers or reports that are not necessarily rigorously peer-reviewed. This figure to the right illustrates how information may be obtained and linked from sometimes unconventional sources to get a more comprehensive understanding of some health characteristics. When approached with a research question generated with secondary data in mind, definitely work with the patron to understand the specific data points of interest and brainstorm potential sources. So for this one in particular, the question is, are there sufficient senior care programs to keep pace with the projected growth of the aging population in the US? Brainstorming on your own, you may come up with these possible data points, defining seniors as a population above 65, defining senior care programs as just anything classified as a senior living facility, or defining programs as the number of specific providers in geriatrics. And then you will be working with your patron to figure out, again, like which variables align with what they were thinking when they posed a specific question. Some data sources, again, brainstorming broadly, consider administrative data sources, such as this one listed here, or more targeted surveys or polls. And again, working with your patron, figure out like how they want to define the various concepts in their question and what sort of data sources are available to them. And we'll talk about the various sources and obstacles and potential limitations to work through later in this session. And I think there was a question posed recently. Let me check.
What are the criteria differentiating structured and unstructured data according to the categories on your slide?
Sure, let me go back. Okay, so structured data tends to be data that is I would say like in a form or have specific fields. Taking the personal health records, for example, in electronic health records, typically there are specific metadata that is assigned to fields and specific, not to reuse the word structure, but it is data that is tabulated and specifically organized, whereas unstructured data you can think of as like more qualitative data that is either free text, things that have information that is not already put into category. So with some of the examples here, clinical notes are very frequently a source of unstructured data in the sense that they are a narrative description of events, again, as opposed to something that's organized in fields and variables. Too many slides. So while researchers tend to turn to existing or secondary data for research because it reduces the effort needed to go out and recruit patients or buy equipment and collect data on their own, this approach does have its challenges as highlighted here. For one, accessibility can be an issue, and by accessibility, we mean the ease of finding, obtaining, and interpreting the data. There can be various barriers, whether it's financial costs related to getting the data, or having to go through a committee or contact person and getting approvals to use the data. Sometimes documentation or the lack thereof can also be a challenge. It's important to understand how the original data set was collected or created. And this ties into, knowing what kind of limitations and biases are present. A lot of the decisions that were employed by the original creators of the data can lead to either a misinterpretation or perpetuation of errors if they're not well understood. With human subjects data in particular, sometimes there may be suppressed values, like the full data set may not be shared even if the findings are shared in a publication. So you would have limited or no demographic information to use for linkage or further analysis of what are called the confounding variables. Variables that may have an impact on findings that are not directly that are not reflected in the collected data. So it's really important to guide researchers to also seek out documentation. This can take the form of READMEs or study protocols or publications about a study to understand how they can interpret their findings. So here's just some resources for further reading. The methods and recommendations for evaluating whether data can be appropriate are also covered in detail in these readings. The first three on the list are publicly available, and the fourth, the Data Librarian's Handbook, can be requested via the usual manners, interlibrary loan, etc. Next, we'll be covering online resources. I'll do a quick scan for questions. Okay, just diving right in then. First of which, data repositories. These are platforms that store and preserve research outputs. There are several types of data repositories, frequently categorized as institutional or subject or discipline specific, or generalist repositories. Institutional repositories are ones that are generally managed by an institution for use by their own researchers or affiliates. Subject or discipline specific ones cover specific research areas. And then generalist repositories tend to be a catch-all in terms of research areas that are covered and even data types. So it is, I think, no exaggeration to say that thousands of these data repositories exist. To navigate these, re3data.org is, I think, the largest listing of data repositories, and allows you to search by subjects, countries, and other features to figure out which platform may have the data you need. And if filtering through the number of registered repositories on re3data.org sounds daunting, the National Institutes of Health has various pages with more or less the same information listing out NIH-supported data repositories. These do include domain-specific repositories as well as generalist repositories. Next, data catalogs. These are an index of data sets. They use metadata to describe the content and location of data, but do not typically store or preserve the data on their own servers. One example is this National Library of Medicine's dataset catalog. As with repositories, not one single source really captures all the research data ever generated. Data catalogs that are not manually curated can rely or do rely on metadata being structured in a specific way when they're ingesting or collecting them from other resources. And this NLM dataset catalog has ingested metadata from a selection of repositories of biomedical data, but is not, again, not exhaustive. OpenAIRE is maintained by an EU-based organization. This also aggregates from a selection of repositories. So government data portals. These may fall into the prior categories of catalogs, where they do not store data but point to websites that do, or repositories. These examples are US-centric, but I am singling out this concept of government data portals because they are critical sources of free administrative data. So again, like data not necessarily collected for research, but can serve research purposes. Some professional organizations, particularly in medicine, collect and share data about their members. Access to this data can sometimes be restricted to members of the particular organization, but as in any other reference interview, when you're speaking with your patient, just learn about what sort of affiliations they may have, and this can broaden the amount of data sources available to them. This example is from the American College of Surgeons, which maintains a number of data sets and registries that track surgical treatment and outcomes. And this is just an example. Next, we'll talk about publications as a source for data. A number of publishers have established dedicated data journals. These cover what are called, or include what are called data articles, which are publications specifically about data sets. there is, in contrast to a normal study publication, a heavier focus on methods and data acquisition, data processing, more of a focus on that rather than the findings themselves. Generally, the scope of these journals are not limited to a specific research area. So sometimes that could mean it's harder to find the data that you're looking for. But these journals in particular are open access, so easy to locate and view. A number of these data journals and more, of course, are indexed with Medline to enable discovery. And this is actually an approach that seems to delight a lot of researchers I've worked with. It really amounts to what is basically a literature search, but with data filters applied to the search string. And here I've highlighted, and I hope it's not too small, the filters and queries that you would append to your search string to find articles with data sets or references to data sets. So this can be really helpful for researchers to see what sort of data has been shared from smaller studies, or to learn what data sets others have analyzed related to a particular topic, as well as possibly what limitations, biases, or other stumbling blocks other researchers have found when they are reusing that data set. And last but not least, this is the broadest approach and also can yield surprising results. Google Dataset Search is one option for looking for data sets. Again, like the other approaches, going through data repository, data catalog, or even PubMed, this produces, non-exhaustive results. If you can't find it here, it does not mean that it does not exist. An important component of being able to find data is, again, very well described metadata fields, and not all data sets have this. And we'll come back to this later, but here's just a quick roundup of some of the websites I have pointed to. All right, a bit of a change in tone. So let me see if there are any questions. Okay. So I want to acknowledge some difficulties or obstacles you may encounter when finding and attempting to access a data source. First, I want to acknowledge that, despite all the policies that have come up encouraging research data sharing, there are still decades of findings that are still not accessible for various reasons as well. Researchers also may not follow through when they're contacted about sharing their data. There have been various studies that have looked into the frequency of data sharing and data sharing practices. This top one by Zhao's team, they retrieved data availability statements for English language studies published in the PLOS One journals. What they had found was very 13.6%, so a slim number of authors plan to share their data in a data repository, which is best practice. It is also the lowest barrier practice for users. Many authors had cited that they were just sharing their data within the paper and in supplemental materials. And this data that they share through their paper tends to be, aggregate data. So summary statistics, averages, means, as opposed to line level or individual row data that researchers can use to perform other analyses and perhaps synthesize for other findings. Another study by Chen's team in 2024 examined trials that were registered on clinicaltrials.gov, and all trials who are registered on clinicaltrials.gov are required to provide a statement declaring whether or not they would be sharing this individual, I've forgotten what IPD stands for, this individual or line level of data. Very few of them stated that they would share this data, and even among data that was funded, publicly funded by the NIH or another US federal agency. Hey Anna, yes, the slides will be shared after this chat as well. And if you're having trouble viewing them, let us know. So as I mentioned before, policies from sponsors of research, research funders, as well as publishers are starting to change the culture of data sharing. The NIH Data Management and Sharing Policy, which we'll be hearing more about next week, is one such impetus, as well as this memo, public access memo from the Office of Science and Technology Policy, which has encouraged or mandated that other agencies follow suit in creating data sharing policies. Publishers, various ones I've named here, have also created data sharing policies, and they've taken different flavors. Some may require authors to deposit the data underlying their studies in a data repository. Others may just require a data sharing statement or data availability statement. The Memorial Sloan Kettering Cancer Center's library has developed a data policy finder that is a great resource for navigating some of these publisher policies. The proliferation of data repositories. So this may sound a bit like a paradox, but it can be very difficult to find data sets among, thousands of repositories. Even for a specific research area, there may be still hundreds of data repositories listed in re3data.org. A smaller subset will be on the list from the NIH, but it still can be daunting to figure out where to start. Data can unfortunately be poorly described. This can manifest as either a lack of metadata or other information about the data set, or maybe be due to like a mismatch of the data set and the repository where it's stored, such that there is little ability to explain how this data was collected. And GitHub is one of the repositories that are listed in the re3data directory. And while it's best known as a resource for sharing code and software, particularly because it allows for version control or describes version control methods, it is really less ideal for sharing and finding research data. Still, it is a source or a repository that researchers use when they wish to deposit both code and data, although very, again, unideal. I briefly mentioned this before, but sometimes data may be shared in an aggregate form. So providing information about groups or categories as opposed to individuals. This can limit the types of analyses that can be done with the data, and sometimes may require contacting the creators or corresponding authors to see if they would be willing to share the individual data or line level data. So you may be working with a patron or researcher with a budget or time constraints. This can also limit what sort of data sets will be reasonable or appropriate for them. And finally, quite often, as I mentioned before, there can be non-responsive creators or authors. Often data is shared in publications with a data availability statement that reads something like, the data sets used or analyzed during this current study are available upon request or unreasonable request. You may not hear a response after you reach out to these authors, and there can be various reasons for this. And I am certainly preaching to the choir, but when it comes to pitching, data finding and the value of this service, it's helpful to frame this as helping researchers navigate this ecosystem of data, helping them also explore whether their researchers' questions are feasible or research approach is feasible. This is especially important for students, figuring out how to, I guess, work a compromise between what research questions they have and what sources are available to them. And finally, another important aspect of this work really is that throughout this process, you are providing what is essentially data literacy education, helping your users critically think through how to assess data sources. And the final or overarching message, I think, for people who are maybe not so in tune with libraries or library services is that we can sell this as a service that enables novel research. So using secondary data for new analyses, evidence synthesis strategies, or machine learning. And not to entirely rehash reference interview training, but when it comes to understanding researchers' data requests, these are questions that you can ask when you meet with patrons, getting to understand their level of expertise with the subject matter or data, as well as what sort of funding that they have available, particularly for large data sets or complex data sets. Also understand specifically, what kind of data they may be looking for, data attributes in terms of what sort of subjects, again, whether they can work with aggregate data or require line level, individual level data, as well as whether they're looking at data collected during a certain year, period of time, or in a certain location. Understanding data types of interest and the research plan can also inform what sort of data is appropriate. And very importantly, of course, keep an eye on timelines and deadlines, or understand how much time they need or have for their work. The reference or a resource that I find helpful here is, again, the Data Quality Literacy Guidebook. Their chapter on conducting data reference interviews really resonated with my own experiences. All right, and from here we have an activity to work on your own. These 4 cases were modified by, from actual tickets sent through the NYU Health Science Library's ticketing system. And I have some guiding questions on the left and would like us to reconvene in, let's see, maybe 2:45. I'd like you to select one of these cases and can work through these 4 questions. When we reconvene to discuss, it's really not meant to be a critique, but brainstorming to learn from one another. And I really look forward to hearing your thoughts. So again, we will discuss again at 2:45 Eastern time, so about 7 minutes. Or I'll check in then and see if anyone needs more time. All right, it is 2:45 Eastern time. Would anyone like extra time to work through any of these? Oh, awesome. I'm seeing some responses roll in for the first case. This is a query from a PhD fellow, someone who's completed their degree, and asking about getting data sets related to air quality and cardiovascular disease risk. Joy is shared, wanting to identify the most data sources. She would want to know the postdoc research is focused on any particular type of air quality measures or pollutants. Fantastic points. Also, if there are any particular cardiovascular endpoints or outcomes of interest. A couple others. Joe has also provided a response to case 1. Also identified that these were broad topics, not specific enough. Also suggested learning more about particular air quality variables, geographic location, time of year. These are great questions. The EPA, yes, is a great government data source if this researcher is interested in the US. Cardiovascular disease risk, Google dataset search, we can see what comes up there. Or yes, RE3 data. Does anyone have any other thoughts about this first case? I like that both Joy and Joe identified again that this request is very broad, and in order to get more information, there are quite a few follow-up questions to be asked of this patron. Case 2, has anyone looked at this one? Thank you for your response, Rachel. So this case is from a medical resident. They are interested in looking at the trends within Crohn's disease management in conjunction with another investigator. They are interested in looking at the data available from the Centers of Medicare and Medicaid Services in particular, and has provided the data point of interest, so number of cases, as well as a time period. And I really like the questions that Rachel has brought up. Where will this person be storing the data? Questions about data security and whether or not data sets will come de-identified or not. Some of these questions you may be able to answer by checking some of the documentation on the Centers of Medicare and Medicaid Services website, but these are great questions to ask. Joy also suggests asking for clarification from the resident to figure out if they're just interested or simply interested in the number of cases or more interested in the treatment, because the terminology that they did use is disease management, so that is a great catch. Ooh, Nicholas has suggested for case 2, finding out more information about the investigator, particularly their name. What would you like to do with that information? I think for me, getting the name of the co-investigator is a great idea as well. It can help you figure out what broader resources may be available to this medical resident. So yeah, that is an intriguing suggestion. Ah, yeah, so in this case, this is a resident who's working with another investigator, so they're colleagues. The colleague has suggested looking into a specific data source on the Centers of Medicare and Medicaid Services. Okay, case 3. Let me see if anyone had shared thoughts in the chat. Yeah, Anna pointed out this is a pretty clear, well-written request, though it might be difficult without the names of the medications. I did redact these because they were very specific and wanted to do that out of respect for this PhD student's research. It would be critical to know the exact details and names of the drugs. That is correct. We didn't really touch upon, financial or sales or marketing data sources, but to understand, what researchers are using, one strategy that I find is my go-to is, again, conducting that literature review in PubMed and seeing what sort of sources people are citing in their data availability statements or as data sources in general. That can be a great starting point. Yes, and Joy brings up the case that, drug sales data are commercial, proprietary, there may or may not be public sources. So one of the things we have to weigh when evaluating some of the results you get through your literature search or Google search is how feasible this request is for that particular researcher. And Amanda brings up a good point. Drug data can be difficult to access, particularly pre-FDA approval. In this case, this would be data that has reached the market, sales data, and we would be looking for potential databases that have this. Yeah, queries to the drug company would yield mixed results if they respond at all. Case 4 is a tricky one. So I did start this session saying that we won't talk about data acquisition or licensing. And these are data sets, if you were to look them up, that have an associated cost and licensing process. You can use this information, you can provide this information to the resident, but it may not be of help. One of the questions you may want to ask that I think I have seen people brought up is, whether they have funding for these data sets, but more importantly, like what exactly do they plan to do with this data? It's really unclear what sort of research questions they have in mind, what they mean to pursue. perhaps with that, you can find alternatives if these databases are not available to the student, to the resident. Does anyone have any other thoughts about these 4 cases? All right. Thank you so much for participating in the activity. One last thought. 2 last thoughts. All right, from Laura. The comment or question, how are they linking air quality and cardiovascular diseases? Yeah, to understand this patron's request further, definitely a good follow-up question to understand, why they've come up with this association in the first place. Maybe whichever literature sources they have in mind can also point you or them to, data sources to reanalyze. And Anna shared a really helpful guide from the University of Illinois on how to find data on pharmaceutical sales and consumption. So thank you. Fantastic. I hope this was fun and helpful. From Joy, these cases evoke the information from prior webinar and data interviews, many parallels to reference interviews generally. Yes, that is correct. I feel like, when I have these consultations with researchers, I am also part investigator as well as, again, someone who's providing the answers or trying to provide the answers. How often do I get requests to find data? I think this, if I were to respond, it's really based on my personal experience being a part of a school of medicine. That's an R1 institution. We are very, very active in research and have a requirement to produce research, or we require medical students to do research. So, we tend to get requests like that because using existing data sets, there can be fewer financial barriers sometimes. It's hard to come up with a specific number, but again, it's partly due to or unique or can be influenced by the particular audience that you serve or user base that you serve. So the last section of this talk is about collaboration. So how can we take these skills and knowledge to provide support on a broader scale, so beyond a one-on-one consultation, as well as to make these services and skills known outside of the library context? So broadly, some accessible collaboration strategies include producing library guides for specific research areas or specific databases or data sources, much like that University of Illinois guide that Anna had shared. Another strategy would be to join other established lectures or workshops as a guest to highlight data sets or data literacy skills, or co-hosting library programming that highlight data sets or data literacy skills. When it comes to finding collaborators, there are various strategies you can employ. Possibly the most natural one would be taking a look at your consultations. So who, in terms of people, departments, or labs, have been reaching out with these kinds of data finding or reference questions? And what kind of data sets or types of data are most commonly requested? And this could lead to creating a workshop or talk or a guide that can be a resource that you can point to. Another approach would be to do a gap analysis, and this is touched upon in the first session, I believe, of this short course. This would be a methodological and structured approach that can entail formal surveys or interviews to understand where to expand or expend resources. So you would be asking what sort of skills or resources would users or patrons like to acquire from the library. And finally, outreach. And it's important here to firmly establish, how as the library or librarian, you would like to work with others outside of the library. And from here, you can start small by word of mouth, advertise through these consultations to get a sense of, who has needs. Or just advertise that you have these skills and can share them in some way. So these are just some examples. When in terms of finding potential collaborators, do get to know your institution and who are frequent users. They can be very valuable partners in the long term. So we are in a bit of a home stretch, but before we wrap up, I did want to provide some examples from my experience in data services at NYU Health Sciences Library. As I mentioned earlier, in response to Leslie's question, I am at an institution that's metropolitan, highly engaged in research. We have a very vast user group and tend to field a lot of questions from students and residents, in addition to academic faculty. This particular case or collaboration had begun through a referral. The organizers were looking for an expert from the library to walk students through looking for secondary data. This talk is given annually near the start of the program to orient students in this training program. And the scope was actually active clinicians, so healthcare professionals who were interested in acquiring new skills in clinical research. The topics are not too different from the ones I presented in this talk, but focusing more so on the context around data sharing, so the data sharing landscape, providing the resources, acknowledging some of the challenges, but also with a discussion on the flip side, so sharing data. The second case is the NYU Data Catalog, and this emerged out of many consultations and informational interviews with researchers at our Department of Population Health. They were looking for a central resource to help their faculty and students locate large national data sets And while this can be accomplished with a subject guide, the team had envisioned a tool with detailed metadata. And the early records in the NYU data catalog described sources such as the US Census, the National Health and Nutrition Examination Survey, the Health and Retirement Survey, among others. The records from these external data sets included a local expert, so someone at the institution, sometimes at the Department of Population Health, who volunteered to be a point of contact for largely students, again, who were interested in learning how to use the data set or finding collaborators as like co-investigators to perform other analyses on the data sets. We are continuing this partnership with the Department of Population Health by cataloging new data sets that the departments purchased or acquired themselves. The code for this platform is open source and available to all, but this is really quite a resource-intensive endeavor. And finally, last but not least, through a mix of reaching out to frequent partners, some cold emails to known experts at the institution, and just referrals from people who were not able to speak but had colleagues who were interested, we organized some day-to-day workshops. So our thematic library organized workshops around secondary data sources. So on the right, we have some studies or data sets that are available to researchers at our institution, as well as the speakers who presented on these various resources. It's been a great way to strengthen our relationships with other departments and teams across the institution, as well as bring broader awareness of local resources. All right, and reach the Q&A. Let me take a look at the chat. Feel free to ask any questions about this content.
All right, seeing the chat slowing down a little bit. If you have any final questions, feel free to put them in the chat. If you want an opportunity to talk, we can also unmute if you have any comments or questions.
Some great comments have come in about the frequency of receiving data requests. Kimberly has noted rarely. Amanda, a solo hospital librarian, has commented every so often, usually when clinicians are pursuing a grant. Isabella has asked, how do you approach communicating expectations and how much time you may need getting back to more involved or complex data reference questions? I really handle this as in the same manner that I handle other types of reference questions. Usually when I get the initial question, I weigh how much time it seems like I would need and provide this time frame to the asker. Within our department, we have a 3-day grace period for providing initial responses, but I think it is reassuring to people on the other end when we reach out initially and provide this this estimate. Sometimes also these, when it's a more complex or involved data reference question, there may be a lot of back and forth or multiple consultations. And that is, something that can be hard to gauge initially. From Anna, she has asked, what advice would you give for starting data services? This one's tough. And I think really it again depends on resources available at your institution to start with, getting a sense of who you can work with as a partner, because it's very difficult to do this sort of thing alone. I think reviewing the panelists' responses too from the first short course session would be really helpful here too. I am wary of speaking for everyone. From Joe, how do you see AI impacting data finding / discovery? And that is a great question that I am also looking into with my colleagues. Some of the issues or obstacles I pointed out before, the difficulty when it comes to finding data sets or finding information about data sets when they're poorly described. I don't think that's something AI can fix when it is also reliant on the metadata as much as we are. It is, possible in terms of constructing metadata from a given data set, like perhaps AI can help with that. But in terms of impact, as with any other tools, I think we have to carefully evaluate whether or not the responses, I think we have to use the same processes to evaluate the impact of AI on data finding and discovery that we do on assessing its impact on other other uses, really. But I do see potential for it to be used, harmlessly to provide data set descriptors or to enhance the way that we're describing data sets to enable future discovery and data finding. Joy asks a great question about how often is your data support involvement extensive enough to warrant research groups inviting you to authorship or a publication? In my experience, this is something I've worked on with some mentors, figuring out what complexity of questions or whether a complexity of a question warrants, additional credit. So far, the questions I've received are the ones I've shown in the activity. I don't think my involvement has entailed more than being the initial or getting people started or setting them off their way to finding an appropriate data set. So it's to date, not often, but it is something to keep an eye out for as someone providing these types of services. Amanda has asked, how do the specific methods used for secondary analysis shape the required attributes of a desired data set? For example, do researchers typically know if they can use unstructured data in their projects? How do you elicit this information in a reference interview? Yeah, that's a great question. I mean, there are certain types of, sometimes the researchers themselves provide or suggest unstructured data without really thinking of it as unstructured data. Like another terminology or related terminology would be like qualitative data. So things that you think of as like narrative information and clinical notes or audio transcripts. Sometimes researchers themselves think that they want to use this information, and that's when they bring up unstructured data as a suggestion. So I would say researchers may not typically think, like if they are bringing up unstructured data as a potential source, they already, have this information in mind and it's a great starting point. But if not, you can elicit this information by asking or, before approaching a consultation, just collecting some or brainstorming some possible data sources and having that information ready to prompt the researcher. When it comes to determining how specific methods used for secondary analysis shape the required attributes of a desired data set, So I think this goes more to, again, like understanding what specific analyses researchers may have in mind, whether or not it's something that's going to require multiple types of data sets, and in which case you would have to understand how the different data sets were all collected, like whether it even makes sense to combine them. So that's, one attribute to consider that's tied to the methods. Another would be, understanding Yeah, I mean, another would be understanding whether their secondary analysis requires Let me get back to you, Amanda. I'm chewing over different types of analyses in my head, but I feel like the most common I've come across are people who are looking to, again, synthesize the multiple types of data sets for things like meta-analysis. So if you have any others in mind, reach out to me and I'll chew on this a little more.
All right. Thank you so much, Michelle, for this wonderful presentation on finding data. I see the chat's, starting to pick up again now, but you have a data repository from previous questions in your library. Oh.
Yeah. Thanks, Estefania. No, my institution does not have a data repository. Because of the nature of data repositories, that they store and preserve data long-term, there are a number of costs related to that are, cost prohibitive for us.
Oh, and the library does systematic reviews. That's another librarian who I don't think is in the data services department, right?
No, not in data services department, but the skills are very similar.
Well, thank you very much. You have Michelle's contact information if you have any follow-up questions on examples she provided or questions about the subject matter. We have the final installment of our series on October 23rd, and that will go over, as Michelle mentioned, the NIH data management and sharing policy and ways to engage with that and with your stakeholders for developing and expanding data services. So thanks again to Michelle. Thank you all for attending today, and hope you have a wonderful rest of your days.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel or select a video thumbnail to watch another video from the channel.